Five signs of fatty liver you can check at home. Let's take a look at what this is.
Five signs of fatty liver disease you can check at home. I'm a liver specialist. First, weight gain around the midsection. Insulin resistance linked to fatty liver often causes abdominal weight gain. Second, constant tiredness or fatigue could indicate your liver struggling. Third, discomfort or pain below the right rib cage might signal liver inflammation. Fourth, insulin resistance can cause acne, darkened skin folds, or hair loss. And fifth, nausea and loss of appetite. This could mean that your liver is overwhelmed.
Okay, so he says these are five signs of fatty liver that you can check at home. He is supposedly a liver specialist also. But I think this video is completely misleading. And I think a lot of basics in clinical medicine is completely forgotten here. So it's time for us to uh, go back to school. So, welcome to another episode of When Doctors Mislead, this time featuring Dr. Saurabh Sethi. He is a American board certified internal medicine physician as well as a board certified gastroenterologist. So, first things first, when somebody uh, refers to themselves as a specialist, saying that I am a liver specialist and I have this much of years of experience, and these are the five signs of. I mean, you don't need to do that. I mean, that itself says that there is something wrong with that person. He's not confident enough about what he's trying to say. So he has to push in some aura of authority, maybe false authority, to convince the audience or the viewer that what he is saying is actually very true. If you want to say something true or something factual, you just have to show evidence for it. It's as simple as that. I mean, it's that's how clinical medicine works. You don't actually push yourself in a position of authority and then talk about it. You don't need to do that. I don't say that, okay, I'm a liver specialist, I have studied hepatology for this many years, I have practiced hepatology for this many years, so now let's talk about fatty liver. No, I don't have to do that, because what I'm trying to tell you is what I know to be true, to be a fact, and I don't need to put in makeup over that to convince you. So when somebody says that I'm a liver specialist and he starts off with saying, I'm a liver specialist and these are the five signs that you can check at home, that itself is something wrong there. So I went and checked his credentials. So he is a gastroenterologist and he's a board certified internal medicine physician. And his actual expertise is not in hepatology, which is liver diseases specialty. It is advanced interventional endoscopy. So he's done a fellowship in interventional endoscopy, and that is what he actually does. He's a very skilled endoscopist, but he also can take care of general hepatology. So in the US, you have specialist pathways. So if you want to call yourself as a hepatology specialist, you have to go through one of those hepatology training pathways. So I've taken this image at the bottom from the American Association of Study of Liver Diseases website, where they very clearly mentions that if you want to call yourself a hepatologist or an advanced hepatology care provider, you have to go for the hepatology training pathways. And this is what makes you an expert, a liver specialist per se. A gastroenterology clearance or a certification from a gastroenterology perspective will only give you a general hepatology competence. So general hepatologists are, I mean, gastroenterologists are hepatologists also, but now hepatology is a completely different branch altogether. So I am not a gastroenterologist. I would never, but even though I have actually seen a lot of gastroenterology patients during my training, I mean, I have treated or I have taken care of Crohn's disease patients, acute pancreatitis patients, chronic pancreatitis patients, the whole spectrum of gastro cases we have seen. But I would never make a video on Crohn's disease or ulcerative colitis or pancreatitis. I have even written a book on pancreatitis. So there is a book called Diseases of the Pancreas, which I wrote with my father in 2014-15. I think it's available on. I'm sure. I'm not sure if it's still in print, but we wrote a book, a handbook for clinicians and gastroenterologists on pancreas. So I have done that much, but even then, I would never make a video on pancreatitis because I don't know about pancreatitis much, and I have not. My work is not focused on pancreatitis. So his work is mostly focused on advanced endoscopy, but then he does all of these on the side to, I don't know, maybe this whole social media influencer fame actually gets into some people and they actually forget how to teach, and they just go on blabbering these kind of very poorly researched, mediocre kind of substandard kind of content, health content, that actually misleads and misinforms people. So please be aware of people who call themselves a specialist initially at the beginning of a video. They may not be actually a specialist in that particular category. So let's see what he was actually trying to say and what the truth really is. So he mentions that these are 5 signs of fat liver. Please note that point, 5 signs. So the first question is, what is a symptom? What is a sign? Very important. This is basic MBBS teaching. So symptom is a manifestation of the disease apparent to the patient, while a sign is a manifestation of the disease that the physician perceives. So a patient will make a complaint, and the physician can actually identify what the complaint is due to. So that's basically a symptom and a sign. So the sign is objective evidence, and the symptom is very subjective. For example, if the symptoms represents multiple complaints of the patient, and if very severe, they drive him to a doctor's office. If not severe, only if the doctors ask about, so they'll ask, or did you have headaches before, or did you have a fever before, or did you have some pain in your joint before? I mean, they when they ask, then the patient might recollect, yes, they had that symptom before, and they would talk about that symptom. So basically, a symptom is something that individual experiences, while a sign is something a doctor or another person notices. So let's look at a few examples. First is patient says, I can't see, sudden blindness. That is a symptom. Now the doctor examines and finds that there is a bleed inside the eye. So that is a sign. So you can say that the bleed inside the eye is because of the is what has caused the blindness. Now why did that bleed happen? There is a cause for that particular sign. So that is the actual disease. So we go to the root cause, and then we find the diseases causing that particular sign and symptom, and then we treat it. But there are conditions where the symptom can also be a sign. So this is very interesting. So somebody says that some patient says that their eyes are yellow. So that's jaundice. And the doctor examines and sees that yes, the eyes are actually yellow. That is medically known as icterus, so which is actually a technical term for jaundice. So the patient also sees the yellowness of the eyes, and the doctor can also see the yellowishness of the eyes. So that becomes a symptom and a sign, which a symptom becomes a sign and a sign becomes a symptom in that situation. So this is also possible. But ideally, a symptom is something that the patient tells the doctor, and the sign is something that the doctor can find out in the patient, but the patient does not know about it. So based on this, when he says 5 signs, so we are looking at objective evidence for actual fatty liver disease, not subjective. Objective evidence for fatty liver. So when it comes to fatty liver, what is the objective evidence? So how can we say that there is actually fat in the liver? Just two conditions. I mean, just 2 points in that. One is presence of fat in the liver. It's very simple. You have to say that there is. I mean, you have to see that there is fat in the liver to call it as a fatty liver. So this can either happen on an ultrasound, like I have mentioned here, or it can happen on a liver biopsy. So you can actually see fat inside the liver cells. So these are the only objective evidence, signs of fatty liver disease. Everything else is not a sign. So the whole heading of that particular reel itself is completely wrong. So the sign of a fat liver is presence of fat in the liver, either through an imaging or presence of fat inside the liver cells on a biopsy. So what was Saurabh talking about all this while? So let's move to each of those points. So number one, he said that weight gain around the abdomen. So there is central adiposity or increased waist circumference. This is not a sign or a symptom of fatty liver. This is actually an association. So we have something known as metabolic syndrome, where people can be overweight or obese. They can have diabetes, high blood pressure, etc. And this is associated with an underlying fatty liver disease. So perfect there is no perfect world where you have an increased waist circumference and you will have 100% fatty liver disease. That does not happen. There are people who are very lean and thin and they still have fatty liver disease, and there are a lot of causes for that. So if you look at the data, uh, central obesity or increased weight around abdomen, it is an association but not a sign of fatty liver. So the prevalence rate, so for example, if you look at how many people, I mean obese people, non-obese people, how many of them will actually have underlying fatty liver, you can actually see that about 15% and 3% respectively, in non-obese person, they'll have just fatty liver, just steatosis, which is basically fat in the liver. 15 to 3 to 15% of patients, that is in non-obese people. So you don't have to be overweight to have fatty liver. 3 to 15% of people can have fat in the liver or fatty liver without even being overweight. But if the obesity level increases. So very obese people, they can have up to 85%. People can have fatty liver on imaging. So yes, there is a definite association between obesity and fatty liver, but being obese is not a sign of fatty liver. This is exactly what we are trying to discuss here. Now, it's not just obesity or increased weight gain. The presence of fatty liver or presence of liver fat is also influenced by the racial or ethnic background, genetic variations, specific genes, family history, a lot of other things. So just because you are, overweight and you have your midsection is slightly bulky, doesn't mean that you have fatty liver, and that is definitely not a sign. It's an association. Now, second is constant tiredness or fatigue. So he says that this means that the liver is overwhelmed. I mean, I think that's not true. Again, constant tiredness or fatigue is not a sign; it is a symptom. It is something that you complain of. Nobody can actually see tiredness or fatigueness. You cannot see it. You can just complain about it. So again, this is not a sign; it is a symptom, and definitely not a sign of fatty liver, because it can happen from simple depression or a complex depression to very advanced cancers, and it is definitely not fully associated with or a part of fatty liver disease. So again, this is not a sign; it is a symptom. So Saurabh is wrong again. Now, pain below the right rib. He says that this is a sign of an inflamed liver. So an inflamed liver can be, it's not that easy to interpret an inflamed liver. So you can have hepatitis, which is inflammation inside the liver, and hepatitis is usually asymptomatic. You don't actually have pain in acute hepatitis patients. So when does liver present itself with pain? So there is a structure known as Glissen's capsule, which covers the liver. It's basically the 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 cloth of the liver, and when the Glissen's capsule stretches, so that part of the liver has nerve endings and it's very sensitive. So when there is a stretch in the capsule covering the liver, that is when you actually have liver pain, and that happens very very rarely. It can happen in a condition known as severe alcohol associated hepatitis, where large amounts of alcohol suddenly causes severe inflammation within the liver, and the liver enlarges suddenly to such an extent that the capsule stretches and you can have pain. Second is metastatic liver disease. So you can have cancers from other parts of the body coming into the liver, and the large tumor burden inside the liver can actually enlarge the liver and stretch the liver capsule. Thereby, you can feel the pain in the liver. Now, pain can also happen when there is a blockage of bile ducts within the liver. So you can have stones or tumors blocking the bile duct, and the blocked bile duct can actually have the bile stagnates in it and gets infected. It's a condition known as cholangitis that can also cause pain. Even simple bile duct stones or any obstruction in the bile duct system in the liver leading to inflammation and infection and cholangitis can also cause pain. So these are the conditions where actually you have a painful liver or a right upper quadrant pain. It's not a rib pain; it's a right upper quadrant pain. And these are the few conditions. And fatty liver does not cause this. So please don't be alarmed that if you have a pain in the right lower lip or a rib or a pain in the right upper quadrant, it is not fatty liver. It may be something else that is more sinister than fatty liver. And pain below the right rib can also be a pain of the rib, which is radiating. And usually the pain of the rib that we identify in my outpatient is something known as costochondritis or TXA syndrome, where there is inflammation of the joint between the rib and the bone in the chest wall. So that inflammation of the cartilage there causes pain, and is known as costochondritis, which can mimic a liver pain. So please remember that a pain below the right rib is not a sign or a symptom. It's basically pain means a symptom. It's not even a sign. So pain below the right rib is not actually a finding of fatty liver. It's something other than fatty liver. So if you look at the data on this, this paper very clearly mentions that the two common presentations of fatty liver, that is non-alcohol related fatty liver, is incidentally detected liver fat and asymptomatic raised liver enzymes. So please remember this. So if the commonest presentation of fatty liver is that you go for a checkup and you find out there is fat in the liver on an ultrasound, or you do a checkup and you do a liver function test, and you can see that on the liver function test the liver enzymes, the SGOT, SGPT, or the ALT, AST is slightly high, abnormal liver test. This is what is the commonest presentation of fatty liver. I mean, there are no actual signs or symptoms to call it fatty liver, and this is actually wrong. So most patients of non-alcohol related fatty liver are asymptomatic, and have non-specific symptoms. So none of these are actually specific symptoms for fatty liver. And this can be from fatigue to right upper abdominal discomfort, but not pain, and common presenting symptoms. And it is important to understand that all of these symptoms are so non-specific. They are mostly symptoms associated with the diseases that they have along with the fatty liver. For example, if somebody is obese or somebody has uncontrolled diabetes or hypothyroidism, they'll feel fatigued all the time, they'll have low energy levels, etc. And this is the reason for the symptom, not the fatty liver. Fatty liver is just an association concerning these diseases. Now, if you move on to the next one, so he said there are these skin changes like acne, darkened skin, hair loss, etc., which are signs of fatty liver disease. So these are definitely signs. I mean, you can actually see these skin changes, but then they are not signs of fatty liver. They are signs of possibly insulin resistance. So everybody who has insulin resistance, there is no hard and fast rule to say that they will have fatty liver. They may not have fatty liver. So these are all signs of metabolic syndrome and insulin resistance, and are not at all specific to fatty liver. So don't worry if you have a few acne on your face and you think your liver is dying. I mean, these are just fear mongering reels that don't inform people realistic things about fatty liver disease. Now, if you look at the actual clinical uh, skin manifestations of liver disease, you can see that pruritus, that is one of the most common symptoms. So if when patients itch a lot along with jaundice, that is known as cholestatic liver disease, that can happen with liver disease. Then you can have something known as palmar erythema, where the palms will be red in color, diffusely red in color, and that is mostly seen in alcohol-related liver disease. And also, it's not part of fatty liver; it is actually liver disease, cirrhosis. And these are all skin changes associated with advanced liver disease. You don't get these with simple fatty liver. So this is the most important part. And you can have spider angiomas, which are small arteries, small blood vessels that appear on the surface of the skin in the form of spiders, in the shape of spiders. That is also part of advanced liver disease, cirrhosis. It's part of a condition known as portal hypertension, where the liver pressures are high. You can also have jaundice in advanced liver failure. You can have hyperpigmentation, which is increased pigmentation of the skin, bleeding abnormalities and related skin manifestations like bleeding spots on the skin, etc. And these are nothing to do with fatty liver. This is all advanced liver disease related skin manifestations. So most of the skin manifestations that they talk about for fatty liver are actually not manifestations of fatty liver. It is manifestations of the metabolic syndrome and because of high insulin resistance. Now, if you look at the last one, which is number 5, he spoke about nausea and loss of appetite, where he again says that the liver is overwhelmed. I mean, again, these are symptoms, not signs, and they're highly non-specific, because nausea and loss of appetite can be seen in first trimester of pregnancy, and also because of a delayed meal. So if you consume your lunch very late, you can have nausea, bloating, and loss of appetite because of that. So these are absolutely nothing to do with fatty liver. Please remember this. These are not signs of fatty liver. These are very non-specific symptoms that can be associated with a lot of disease conditions. So don't worry if you have these symptoms uh, in the acute period. But if this is persisting, please go see a doctor so that he can actually diagnose you with the disease that really is causing these symptoms in you. And fatty liver disease is usually asymptomatic. It does not have any symptoms, and don't worry about on that aspect too much. So, what are the actual symptoms of fatty liver or signs of fatty liver? None. There are no symptoms. There are no specific signs or symptoms. Fatty liver is an asymptomatic condition. It is usually identified on imaging or biopsy. It commonly presents as an abnormal liver test only, and not like what he is saying at home. You can't identify fatty liver at home, it is impossible. And symptoms as well as signs of fatty liver are mostly due to the underlying associated disease like diabetes, obesity, high blood pressure, sleep disorders, etc. So, if you have such underlying diseases, then please check for fatty liver disease manifestations by speaking with your doctor. So you can go for a liver function test and ultrasound to see if there is a fat deposition in the liver. So you cannot identify fatty liver at home, and you cannot definitely not based on these symptoms and supposedly signs that Dr. Sethi has misinformed you on. So basically, Dr. Sethi has forgotten that there is a difference between sign and symptom, and he's completely messed up his MBBS teaching. I think doctors should stick to basics first and then talk about specialized care. Because if you don't do that, it's going to be a load of misinformation. So whenever a doctor cannot do good, he must be kept from doing harm, which is why I have to make this series. So I'm not saying I'm perfect, but if people find mistakes in what I'm trying to say or what I'm saying, please correct me. But as long as other doctors keep making mistakes, which I find will misinform the public by and large, I will make videos like this so that you can be better informed. So until the next time, take care and have a great day.